Welcome to this week's edition of Ask an MS Expert. I'm Jon Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering questions and connecting you to resources. Getting an MS diagnosis isn't always easy. Today, we're talking about that journey to a diagnosis with Dr. Michael Roberts. We'll look at common first symptoms, tests, and diagnosis criteria, dealing with the emotional impact of that diagnosis, and the next steps to take after being diagnosed with MS. Dr. Roberts is a neurologist in the multiple sclerosis program and an assistant professor in the Department of Neurology at Barrow Neurological Institute. We're also closing out MS Awareness Week today, and before we meet Dr. Roberts, we're going to share a short video clip where you'll meet Juan, who shares a bit about his journey to his MS diagnosis.
My journey to reaching this MS diagnosis was confusing, very frustrating, and it took a very long time. The symptoms started around 2011, going through different doctors, a lot of misdiagnosis, my weight, diabetes, sciatica, energy drinks of all things. Year 7 or 8, the neurologist recommended for me to get MRIs on my brain. The MRI came back with finding lesions on my brain. I immediately started Googling every question known to man. What is MS? Is there a cure for MS? Will I go blind? Will I be able to Does it affect your memory? Does MS change your personality? Black and white answers, downward spiral of what my life was going to become. When you're left on your own to find answers for something that nobody could really give you answers on, it was very overwhelming. That went on for a good period of time until I was able to sit with my MS specialist to get those resources that I should have been getting all along. Talking with others, resources and support groups, I found that to be tremendously helpful. A cure would open up so many possibilities. I just try to carry on a day-to-day basis. I hope today works out well. And that's all I can really set my goals towards. We don't know what tomorrow's going to be like.
Well, now I'd like to welcome you, Dr. Roberts, and thanks for being with us today.
Thank you for having me. It's a pleasure and honor to be a part of the National MS Society's MS Awareness Week programs.
You know, stories like Juan's are not uncommon, and we want to talk about why that is. But before we get to that, can you start us off by just giving us a brief overview of what MS is?
Sure. MS, or multiple sclerosis, is a neurologic disorder that is an autoimmune disease where your immune system gets confused and instead of keeping you healthy, actually attacks the coating of the nerves in the brain and spinal cord. That coating that we call myelin helps support the nerves, helps the electricity that goes through nerves go faster and get to where it's supposed to be. And when that gets damaged, it can lead to many symptoms, including numbness, weakness, vision loss, dizziness, other things like that. And people can have those symptoms either coming and going or slowly getting worse over time.
For some people, their MS diagnosis can come quickly, but others like Juan, well, it can take them years. What makes MS so tricky to diagnose, and why are so many people misdiagnosed?
One of the biggest complexities of multiple sclerosis is that it affects everyone differently. I briefly kind of touched on how it can cause so many different symptoms, whether it's vision loss or numbness or weakness, and the course of the disease can be different, whether it's what we call relapsing remitting, where people have attacks that then get better, or whether they slowly get worse with progressive disease. And the fact that it can present with so many different forms and different presentations can make it difficult to diagnose and catch, when many of those symptoms can be caused by other diseases as well.
Can you tell us which tests are used to arrive at an MS diagnosis?
The mainstay of diagnosing multiple sclerosis is both the neurologic exam by a neurologist and MRI, which are the most commonly ordered tests looking for actual visible lesions in the brain or spinal cord. When that doesn't give us a true confirmatory diagnosis, other tests that can be ordered are what we call OCT, optical coherence tomography, which looks at the thickness of the retina in the eye, evoked potentials, which measures the speed of the electricity either in the eye or the spinal cord, or a lumbar puncture, where we actually collect fluid from the back that comes from the brain and spinal cord compartments, and we can test that for autoimmunity as well.
For many people, the journey to a diagnosis starts with some unexplained and sometimes frightening symptoms. Frank wrote us that he was diagnosed with MS 2 years ago after experiencing sudden vision problems. So what are the common initial MS symptoms that people might experience? And are those symptoms the same for everybody?
The easiest part of that question is to answer is no, the symptoms are not the same for everybody. They're different for almost everybody. What we mostly look for are what we call demyelinating events, which are classic syndromes of symptoms that are typical for an immune response attacking that coating of the nerves. And talking about his experience with vision problems, that can result in vision loss, what we call optic neuritis, which typically presents with pain and vision loss in one eye that lasts for longer than 24 hours and may slowly get better over time. But it can also develop in double vision with eye movements. And then other things that can present are numbness, oftentimes in one half of the body or one part of the body, or weakness. And that can result from either lesions in the brain that might look like what most people get concerned about for stroke, like facial droop and weakness with left arm and leg weakness or right arm and leg weakness, or can present as what we call transverse myelitis, which is inflammation of the spinal cord. And that may present more with both legs being weak and everything above one line on someone's body feeling normal, and then there being a line that once you cross that, everything is numb or weak or have bowel or bladder changes all kind of at the same time. These symptoms that do share, whether it's vision loss or double vision or numbness or weakness, the things that do kind of make us share those experiences, that they're often come on gradually over the course of hours or a day, not instantaneously, and they last for longer than at least 24 hours, often can last longer than that, days or weeks. So not as typical to just come and go over minutes.
As many of our viewers already know, MS symptoms can come and go, and that makes it tricky to know what you should be paying attention to. How does a person know when they should be seeking medical help?
Well, I always think that you as the person, either knowing that you are living with MS or concerned about medical problems, know you and your body best. And so ultimately, if you have a concern that you don't feel is being fully explained or addressed, then it's appropriate to seek medical care and to seek more additional medical care if the initial medical care doesn't work out. And things that we really get worried about specifically for multiple sclerosis diagnosis or for multiple sclerosis relapses, if you already have a diagnosis, are these neurologic symptoms: numbness, weakness, vision loss, dizziness, imbalance that come on, again, not necessarily instantaneously, but over the course of maybe a day or days, and then lasts for days or longer. And even if it gets better at that point, those are symptoms that are concerning and should be sought by a medical professional.
Well, while we're talking about medical professionals, what type of doctor provides that MS diagnosis? And is it important for someone who's diagnosed with MS to be seeing an MS specialist?
So all neurologists are trained during their training in multiple sclerosis and can start that process of diagnosing multiple sclerosis and giving a diagnosis of multiple sclerosis. If there's questions about whether the diagnosis is accurate, or once you've been diagnosed with MS, I do believe everyone should see an MS specialist. Realistically, there's not an MS specialist near everyone, and so it may not be the neurologist you see all the time, but at least for a consultation to make sure you agree with the diagnosis, you understand the implications of that, and guidance on what levels and types of therapies that are available, which have really become a subspecialty level of expertise. And then that MS specialist may take over and be your primary neurologist caring for you and your MS, or they may be able to give consultation to a general neurologist closer to home if it's too far to travel to an MS specialist.
Well, we're going to circle back to all those MS therapies in just a moment. Before we do, I want to explore something else with you. You know, historically, MS was believed to primarily affect people of European descent, but recent findings show an increase in the number of people being diagnosed with MS from the Black and Hispanic or Latinx communities. So is MS on the rise, or is there another explanation for what we're seeing in these communities?
So we don't really know, I think, if it is truly on a rise or if there are differences in our techniques. Certainly, there has been an undercount of multiple sclerosis in historically disadvantaged communities, whether it's Black, Hispanic, Latinx, or American Indian or Native American, that gets ignored, and in men of all races that also has gotten missed. And when we see that the medical community has become more aware that this is not just a European, not just a white female disease, that everyone can get multiple sclerosis, we're getting better at diagnosing those people who had multiple sclerosis all along, but are now getting the diagnosis more appropriately. So that's one thing that could be raising the level of diagnosis and rates of diagnosis. Additionally, over time, the actual diagnostic criteria for multiple sclerosis continue to change to try to make it more accurate, to try to allow us to diagnose people faster and sooner so that they can get on treatment. And changing the details of the diagnostic criteria that we use to diagnose someone can also make it easier for us to diagnose someone and then increase the numbers in these studies. With large medical databases now available with electronic medical records and everything being in computers and databases, it's also easier for us to go back and accurately identify who's actually been diagnosed with multiple sclerosis. And so we're doing more accurate counting, more accurate diagnosing, and recognizing the diagnosis in communities that used to be underserved and underappreciated in the multiple sclerosis community. All of that could raise the reported numbers of MS without an actual true increase in MS. However, it is also possible because of environmental changes over time and overall health changes over time in the world population that the actual prevalence, the rate of MS in the community may be increasing over time.
Well, to one of the points you just made, we heard from Angela, who said her MS diagnosis was delayed by several years because her healthcare providers didn't consider MS as a possibility because Angela is Black. Why does this happen? And is this really a common experience?
That unfortunately is a common experience. And ultimately, it's a combination of systemic and structural racism in medical education, as well as in medical research. And then also lack of awareness in the communities and in the general population as well. And so there's multiple layers to why that happens. Unfortunately, it's common in medical school. When you take the exams to become a doctor, we learn to take little cheat sheets of what that first sentence says of what somebody looks like, and make pattern recognition of what a disease looks like. And the pattern recognition that is taught still in medical schools commonly is that MS is a white disease. And so then people graduate and become doctors, and that is what they've learned. When we actually look at the real data in the real population, we know that not only is that not true, that in the United States, at least in one California study, that the rates of MS, especially in younger individuals, were higher in Black Americans than in white Americans. And so it's a real problem in medical education. And then also in awareness campaigns to actually make sure that people who have symptoms of MS are actually recognizing it and getting to a doctor to ask about it and to be aware of it. If a young white female has an episode of optic neuritis, they may themselves have heard of multiple sclerosis before and ask questions. Someone who is Black, who hasn't been a part of outreach campaigns and from the medical community and education campaigns, may not have heard it themselves and may be less prepared to be a self-advocate for a diagnosis that they're not familiar with as well. And so there's a lot of education that needs to be improved to improve that delay.
Do those initial MS symptoms vary among different races and ethnicities?
It is possible. There's some research in this that certain ethnicities or racial categories seem to present with more severe, more motor symptoms. And so that's specifically in Black and Hispanic Latinx communities in the United States, where most of that research has been done. And it does seem to show that motor symptoms, so weakness presenting, seems to be more common in those populations, or possibly optic neuritis in those same populations, compared to sensory symptoms like numbness, which may be more common in the white population. However, it's important to distinguish that any of those symptoms can happen in any of those racial or ethnic categories. And if we really believe, which I do, that race is a social construct which does not dictate biologic disease course, then these research saying that there's actually a difference in presentation may be a result of those more severe cases being the only people that the medical community actually catches and diagnoses, whereas someone with numbness who's Black or Hispanic Latinx may just not get the diagnosis and not be included in those studies. So unclear, but it is possible that there are differences based on racial and ethnic categories for symptoms.
What about non-medical but cultural differences? Are there any cultural differences in these minority communities that may result in someone getting diagnosed at a later age?
Well, so then we have to kind of get into smaller communities rather than larger, broader spaces where cultural differences may very well contribute. And so within certain communities, there may be less trust of the medical system or less availability depending on where they go to receive medical care, or where they go when they get sick, and who they trust to go. And if they're going to someone or not having access to someone who recognizes multiple sclerosis, that can in itself contribute to these delays.
You mentioned earlier that the first step in treatment is determining the right therapy. There's more than 20 medications that have been approved now to treat MS here in the US. I guess a couple of questions come to mind. How does someone choose the best disease-modifying therapy for them? And what's the importance of starting treatment early?
Yeah. I'm going to answer your second question first, because regardless of which treatment you choose, we know that starting treatment early is really important. And that is because an easy way to describe all of these 20 different medications is that they are in some level immunomodulatory or immunosuppressive. They all reduce the activity of your immune system, which is what attacks your brain and spinal cord in MS. And we know that the immune system is more active when we're young. And so people with multiple sclerosis are more likely to have more relapses, more attacks, more new symptoms, new inflammation in their brain early in their disease course when they're younger. So getting on a medication that has been proven to stop that inflammation is most effective early in the disease course. Also, once we have damage in the brain or spinal cord from MS, unfortunately, despite lots of research in this field, we don't have any FDA-approved medications or proven treatments that repair or fix old damage. And so the name of the game in MS is preventing new lesions, preventing new inflammation in the brain. And so we need to get on a medication early to prevent those future attacks, future relapses, which has been proven to reduce future disability. And so that's really important. Which medication to choose to do that is a very individualized and personal choice. And that has to do with many factors. While all of the medications we have are what we call immunomodulatory, reduce the inflammation from your brain, they do it in slightly different ways, and they do it to different extents, ranging from ones that are very, very strong at treating MS, but carry with them maybe more side effects or more risks, specifically of infection, or ones that are very, very safe, but maybe aren't as strong at treating inflammation. To decide where on that spectrum you may be or should be, the MS specialist, work with the person living with MS on how many relapses they've had, how many lesions we can see on their MRI, where those lesions are, whether it's in the spinal cord or the lower part of the brain that we get more worried about, or whether it's all up in the higher part of the brain that has a little bit more space and a little bit more forgiveness, if you will. Race and ethnicity we can take into consideration because we know that Black and Hispanic or Latinx populations, especially in the United States, do have worse outcomes and may have had more diagnostic delay, and whether that should play a role, as well as the person living with MS's preference on how they take their medications. Is doing an injection under your skin something that is doable for you, or do you have a needle phobia that would just never be something you could do? Are you good at remembering to take pills, or is that something that you would always forget or hate? Can you afford to schedule regular doctor's appointments to get an IV medication, or would that not work with your lifestyle at all? We have to balance the risks, the benefits of how aggressive one person's MS is, how aggressive they want to be at treating their MS, and what fits with their lifestyle so that they can stay on a medication long-term. Because it's not just about getting a treatment one time or getting started on the medicine. It's about finding the fit of a medicine that you can stay on long-term to really change the long-term course of multiple sclerosis.
We heard from Valerie, and she told us that after many doctor visits, she was finally relieved to have an answer to her unexplained symptoms when she received her diagnosis. But along with that diagnosis, there comes that fear of the unknown and the unpredictability of MS, which is awfully common among newly diagnosed folks and people who are not so newly diagnosed. So what can Valerie do to address those feelings of uncertainty?
Well, there's quite a few things. Certainly one is talk to her doctor and who may be able to help contribute to an idea of prognosis, of options, and help answer some of the questions that she has. In addition, there's a lot of great resources, especially from the National Multiple Sclerosis Society, who we're working with today, whether it be support groups through the local chapters, meeting people who are on medications that you are considering taking, or being a part and requesting assistance from their navigator program that can help find the resources that you need. Additionally, if you feel like there's a significant component of depression or anxiety, which is very common, not just because this is a big life-changing event by receiving a diagnosis of MS, but also because MS itself may change some of the structures and chemistry of the brain, may contribute to depression and anxiety. It would be important to reach out to someone and ask for care for that as well.
We're living through some of the most stressful times in modern history, and we know that emotional well-being is an important component of overall wellness for everyone, perhaps especially for people who are living with MS and other chronic illnesses. So what are your recommendations for managing stress?
It's a little different for everyone. And so I encourage everyone to have an open mind to find something that works for them. And if they try something and it doesn't work, it's okay to stop it. Oftentimes what we talk about for people with exercise is really good to manage stress for people who can do it. And exercise has some evidence that it helps maintain mobility and strength in MS itself. And so if you're able to do that, and that's something that you enjoy, that's a good feature. Sometimes just unplugging from some of the stressful events, identifying the things that are really increasing your stress in life, whether it's the news or kind of negativity about a diagnosis or medications that you're receiving from a certain area, being able to distance yourself from that might help as well. Finding your support groups, the people who make you feel good, make you feel cared for and prepared for life, and really being with those people in that support group, if you have it, and finding it, I think is really important. And then being honest that we don't control everything, and it's okay to have some emotional stress right now, and it's okay to have anxiety, have depression. But if you do need to get that addressed, reach out, and it is okay to have a counselor or a psychiatrist or your MS specialist to just talk about this. Many MS specialty clinics actually have social workers right in the clinic that can also help with some of these stressors as well.
Well, you've shared some really helpful insights about what to expect and how to best manage that journey to getting an MS diagnosis. Now I'd like to ask you to share your top 3 takeaways that you'd like our audience to remember.
Sure. So first, I would say, you know your body, and if you're concerned, speak up, seek care, and find someone who's willing to work with you to find answers for your questions. Number 2, if you have been diagnosed with multiple sclerosis, you should see a multiple sclerosis specialist at least once. And number 3, if you have multiple sclerosis, more likely than not, it is important for you to be on a medication which can change the course of MS. Not everyone is right for every medication, so it's important to talk with your MS specialist or neurologist about what fits for your case.
Well, thanks to everyone who submitted their questions, and thank you, Dr. Rovers, for being with us today.
Absolutely. Thank you for having me.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the National MS Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. There are ways for you to get involved, and you'll find out about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Michael Rovers for joining us today. Please remember that a recording of this webinar is going to be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find out about our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Michael Robers and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.